Okay, I'm going to share a patient's story with you. This is Mary, and some of you may know Mary, and Mary's family have very kindly agreed for us to share her story with you this morning. So in November 2011, Mary was cycling to work and was involved in a road traffic collision. She was hit by a lorry and sustained severe injury to her head, pelvis, chest, thoracic spine and limbs. Mary was brought to our major trauma centre, resuscitated in our emergency department and admitted to the intensive care unit, where she spent a number of days critically unwell. Thankfully, she survived that period and ended up spending 7.5 months with us here in this hospital, latterly waiting for a specialist rehab bed. When she was discharged from our hospital and taken to Putney, she was in what's known as a minimally conscious state. From Putney, she was taken to the Homerton Neuro Rehab Centre with Dr. Lou, and was looked after there, and then more recently has been admitted to a nursing home where she requires intensive nursing and therapy care, and she remains in a minimally conscious state with some fleeting awareness, but predominantly minimally conscious. This is what Mary's father had to say. And we think that Mary's case really illustrates what Alison said earlier and some of the other speakers, in that tragically some cyclists, and I'm a cyclist, tragically some cyclists do die from their injuries, but what we think is possibly underappreciated and certainly underreported is the large number of people that survive severe injury and go on to have some form of disability for months or years after their injury. We follow up patients after traumatic injury. We have an outcomes facility, and we talk to cyclists at varying time points in the year after their injury. And these are some of the reported outcomes that people tell us. And overwhelmingly, cyclists talk about an impaired quality of life, be that physical, in that they have problems with mobility, with doing normal activities of daily living, sitting at a computer. They may be psychological, in that people get very anxious or depressed. They may have flashbacks or problems sleeping. They may be social, where people feel isolated. They don't want to go out. They certainly don't want to get back on their bike. And usually there's a degree of all three. Interestingly, or possibly sadly, only 2/3 of our cycling patients have returned to full-time work 4 to 6 months after their injury. And that's significant for them financially, for them and their families, but also for the economy and our society. And cyclists tend to be, there's a lot of us here today, young, fit people, very motivated, want to get back to work. And I think that the quote at the bottom of this slide, given by somebody who's here today, one of our ex-patients, really sums up some of the outcomes, in that he said people have their lives wrecked by serious injuries. Maybe not forever, but certainly for much longer than we possibly appreciate. So cyclists and other trauma patients have significant rehabilitation needs, and these start really as they land at the major trauma centre, and rehab starts early. It starts while the patients are in intensive care. And I think it's possibly worth pointing out very briefly that rehab is not just about physiotherapy. Okay, rehab involves complex interventions from a number of specialists. It may be occupational therapists, speech and language, nutrition, social workers, psychologists. There's a whole group of people that collaborate together to try and maximise outcome for injured patients. Some of our injured patients, like Mary, will be taken to what's known as a level 1 specialist inpatient rehab facility. These are high-cost, low-volume centres. There are relatively few of them, and there are often prolonged waits to get into these centres. When the patient gets there, they get intensive specialist rehab led by people like Clarence to try and maximise their quality of life and their recovery. Some patients will be taken to their local hospitals, repatriated, where level 2 rehab or inpatient rehab will continue. And then obviously some people go home, and they will continue their rehab in the community, and availability is variable depending on where you live. And some of our cyclists, as I say, motivated individuals, have reported actually paying for private physio because they really want to get back to as best pre-injury state as possible. This is some data from a colleague of mine who couldn't be here today, and she looked at patients with significant rehab needs, so whether that be physical, psychological or social, and looked at the provision that they actually got. And you can see that there's an obvious disparity between rehab need and rehab provision across all levels of care. And I think that this is possibly a really forgotten area of trauma care, and it's certainly something that's very, very important to the patients. And in fact, our patients report a phenomenon called falling off a therapeutic cliff, which sounds a bit odd. But think about it, patients are in hospital, they're surrounded by doctors and nurses, they get physios and other therapists coming to see them every day, their pain is managed, they've got those fabulous hospital beds that are electric and help them sit up and lie down and get comfortable. But people really want to go home. People want to get back to normal life, so they're delighted when they've been given the discharge date. They get home and then bang, they fall off that cliff. They're on their own, even if they're with their family. Every ache and pain is magnified. People worry about wounds bursting open. It hurts to get into bed. It hurts to turn over in bed. And people feel very isolated. So we need to try and meet this need for when patients go home and are trying to self-manage and get back to health. So to finish off, I wanted to share with you an initiative that we're working on at the moment. And this is a National Trauma Survivors Network. This is an example of an American network. And cyclists are ideal people for this, or cycling patients, I should say, are ideal people for this. The resource is aimed at patients primarily, and it will teach people how to continue their self-management, advise them on rehab, advise them on what is possibly normal for their stage of recovery, and give them an opportunity to share experiences with other survivors should they wish to. Friends and family are often the forgotten victims of severe injury, and so this resource will be available for them to let them feel that they're not alone and they're not unique. And finally, we have a great deal of expertise in this centre. We have a great deal of trauma expertise altogether, and we feel that there are many centres that wouldn't necessarily understand the complexity of multiple trauma rehab, so we're hoping to share that expertise with other trauma centres and hospitals. Sadly, as a cyclist, I wish we could prevent every cycling injury, but we can't. But what we hope to do with a resource like this is help patients take positive steps to improving their long-term outcome. Thank you.
Has content effect in their lives, not just with the medical symptoms, but family, social, vocational roles, and the long-term quality of life. And I think in particular, we're talking about the impact on mood, anxiety, self-confidence, and self-esteem. The cycling-related injuries are very heterogeneous, and so the patients have very complex rehabilitation needs, but we understand that the delivery of the rehabilitation is quite piecemeal, and often it's not adequate, and patients and their families have a lot of difficulties navigating through the system really to get the appropriate needs and support. I think the other thing that we're picked on is the difficulty with peer support of long-term survivors of cycling injuries. Often they feel isolated, and I think it's very important that they have the right forum, maybe web-based or whatever, so that they can speak to one another, to exchange stories, and to get the appropriate support. And I think that's also a role for the patients to educate us as health professionals about the long-term impact of their injuries.
But there's very fertile material here, which I think if people knew about would produce change. So thank you very warmly for your participation. Thank you, Barts Charity.